Before we begin, a quick note. Everything in this video is for general educational purposes only. It's not medical advice, and it doesn't replace a conversation with your own healthcare provider. Now let's get into it. Two of the most common over-the-counter pain relievers on the market, Tylenol and Ibuprofen. Most medicine cabinets have both, but a lot of people don't know that they work completely differently, that they're better suited for different types of pain, and that they carry different risks for different people. In this video, we'll break down the science, including one honest answer about Tylenol that might actually surprise you. Let's talk about how each of these drugs actually works, because the answers are very different. Ibuprofen's mechanism is well understood. It belongs to a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. It works by blocking enzymes called COX-1 and COX-2 throughout the body. These enzymes produce prostaglandins, the chemical signals that trigger pain, fever, and inflammation. Block the enzymes, reduce the signals, reduce the symptoms. Because ibuprofen acts throughout the entire body, it directly reduces swelling at the site of injury. That's why it's more effective for conditions involving inflammation. Acetaminophen, the active ingredient in Tylenol, is a different story. It has been in use for over 100 years. And here's the honest answer. Scientists still don't fully know how it works. It was approved under an older regulatory system based on historical use, not a modern clinical trial confirming its mechanism. The leading hypothesis is that acetaminophen is metabolized into a compound called AM404, which may act on pain signaling pathways in the brain and spinal cord via cannabinoid and vanilloid receptors. But this remains under active study in humans. What is confirmed, acetaminophen does not reduce inflammation. Its fever-reducing effect likely acts through the hypothalamus, and for reasons not yet fully explained, it works for many types of pain. So which one should you reach for? Choose Tylenol, acetaminophen. If you have a tension-type headache, fever alone without inflammation, stomach ulcers or GI issues, heart disease or kidney problems. If you're pregnant, always check with your doctor first. Or if you're treating a child under 6 months old, ibuprofen is not approved for that age group. Choose ibuprofen if you have muscle strains, sprains, back pain from injury, arthritis or joint inflammation, menstrual cramps, dental pain, a sore throat caused by strep, or a headache with an inflammatory component. The key question to ask yourself is inflammation part of the problem? If yes, swelling, heat, arthritis pain, ibuprofen is the more targeted tool. For simple pain or fever in people without reasons to avoid NSAIDs, either can work. But they're not interchangeable in every situation. Both medications have important cautions, and they apply to different groups. Be careful with Tylenol if you have liver disease of any kind, if you drink 3 or more alcoholic drinks daily, or if you take multiple products that contain acetaminophen. It's in cold medicines, flu remedies, and prescription combination drugs. It's easy to accidentally exceed the daily limit without realizing it. Be careful with ibuprofen if you have kidney disease or reduced kidney function, heart disease, high blood pressure, or a history of heart attack, stomach ulcers, or a history of GI bleeding. Or if you're pregnant, especially after 20 weeks, where the FDA specifically warns against NSAID use due to risk of fetal kidney complications. When in doubt, ask your pharmacist, especially if you take any prescription medications. Drug interactions and personal health history matter, and your pharmacist can review your full medication list in minutes. That's what we're there for. I'm the AI pharmacist. Thanks for watching.